Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Jose Angulo. He is a technical services veterinarian and also a PRRS specialist at Zoetis. Thanks for joining us today, Jose.
Thanks for having me, Joe.
Now, traditionally, I think PRRS control efforts have really been focused on the breeding herd, haven't they?
Yeah, that's right.
And so you've been looking at, once you maybe try to clean up a breeding herd, the impact that the finisher herd can have on the breeding herd. Is that right?
Yeah, and this is something that we have been working during the last years. If you look at the research on PRRS during the last years, all the research, or most of the research has been focused on the sow farm, and to try to identify the risk factors in sow farms, to keep the PRRS virus out of those sow farms, and that's okay. But in many systems, what we have seen is that when we spend a lot of efforts in the sow farms, we're still having outbreaks on those sow farms.
And how did you come across this? Was this just producer experience, or were you doing some trials where you thought the breeding herd might continue to stay clean but then got infected again, and then you traced it back to the finishing herd? How did that work?
Yeah, and most of them are observations from production system and practitioners. But the last fall, I have the opportunity to start my master degree in the University of Minnesota. I'm working with Muncie, and basically I'm working on the master program around PRRS epidemiology. And we decided to go in that direction because looking at the research again and those field observations, we believe that we need to start focusing more on understanding the role of the growing pigs on PRRS spread on those regional areas. So,
and why does that occur, do you think? Because most of these farms today, don't they have separate site production?
yeah, and that's a very interesting question and important question. That's something that we're trying to figure out with the project that I'm doing with Muncie at the University of Minnesota on my master, is to identify the risk factors and evaluate also the incidence rates on growing pigs. So right now we are running a project. We enrolled 60 win-to-finish sites from different systems, and we're monitoring those win-to-finish sites every month through our fluids. And we're measuring when they're getting infected with PRRS, but also we are surveilling those to identify risk factors and try to understand what are those risk factors to minimize the spread of PRRS virus from the growing pigs.
And this must be particularly important to any operation that is trying to eliminate PRRS, or maybe even coming close to eliminate PRRS. This could be the one
or
missing
even
piece.
controlling PRRS. And we just also run a retrospective analysis when we identified the relationship between the growing pigs prevalence and the risk of getting infected in the sow farms. That was something that we presented at Lehman Conference. And this analysis came out because, again, we were trying to identify systems and to enroll in the project. And I had a conversation with many practitioners in the industry, and one of them was Paul Jeske. And in that conversation about the role of growing pigs and the spread of PRRS in regional areas, he said, well, this is something that I have seen for many years in my practice. And that kind of conversation is when we decided to go back to one of his production system, one of his clients, and run a retrospective analysis with the surveillance data that they had, because in this particular system, they have negative filter sow farms in a specific region. We're talking about 12 miles radio geographical location, and then 18 growing pigs on that specific area. And we took data from the last 4 years from their surveillance, and we just describe some of the metrics that we use in epidemiology, like the cumulative incidence on sow farms, the incidence rates, infection rate, and also a regression analysis to determine if there is an association with the breaks that we're seeing in sow farms with the prevalence on growing pigs.
What would be the route of transmission, though, from the grower-finisher pigs back to the breeding herd?
Actually, that's a common question, and that was one of the questions when we presented this analysis, because in this analysis, one of the outcomes was that it is a significant association between the prevalence in the growing pigs and the sow farm. So as the prevalence in growing pigs increases, we have a risk of the prevalence in sow farms increases as well. And one of the questions during that presentation was what is the reason, I mean, what is the spread, how they are getting infected. But that's something that we're trying to figure out with this project at the University of Minnesota, because we need to identify the risk factors and work around those risk factors to minimize that risk of spreading the virus through the sow farms. So right now, what we can say with this analysis is that growing pigs do represent a risk for the sow farms, and it could be part of the scenarios or the problem where we're getting frequent outbreaks in sow farms. And so one of the recommendations out of this analysis was, okay, let's try to keep the prevalence in growing pigs as low as we can. And in order to do that, we need to understand better what are the risk factors, what are those factors that make the prevalence increase.
Well, and that was my next question. I mean, it seems like you really need to tighten up your control programs in the finisher pigs. How do you go about doing that?
Yeah, I mean, there's different strategies, and of course, I mean, vaccination is one of them. But even with vaccination, and this is something that we're going to learn also in this project, there are different protocols, different strategies for vaccination. So right now, we need to understand also what is the best way to maximize the performance of the interventions that we're putting in place to not only minimize the clinical signs and the economic impact, but also reduce the shedding in order to minimize the risk of other outbreaks in sow farms or in the area.
Well, and I know you've looked at this pretty closely over the years. What have we learned as an industry about the proper timing of vaccination in the grower-finisher herd?
Well, in my experience is that we need at least 4 weeks before the challenge to generate the immune response. And in many cases, I mean, we're vaccinated earlier because we have an early exposure in the nursery. So timing is one of the most critical aspects for vaccination, piglet vaccination. The other one is the status of those pigs at the time of vaccination, if they're viremic or not. And this is related to the stability status of the sow farm. So from my standpoint and from my experience, those two are the most critical factors when we're talking about vaccination. But also, PRRS is not just vaccination, and that's a very important point. There's many other factors that we need to work with, like pig flow management practices, other management practices in the growing pigs that many times we don't care. And that's something that we're trying to identify in that project, what else we need to do.
And what else can be done?
Yeah, beyond vaccination.
Yeah.
To minimize and be more successful on PRRS control and elimination programs.
What about maternal antibodies, though? Because if you're vaccinating a sow herd, I mean, is there a risk with vaccinating too early, vaccinating the grower finishers too early, or have you found that that's okay to do?
Well, right now there's many production systems that they're vaccinated at processing or earlier because of the timing that I was telling. And in my experience, I would say that I will overweight the timing criteria over maternal immunity. If there's any impact on maternal immunity, it's less important than the timing to generate that immune response. So in cases where we have an early exposure in the nursery, we vaccinate processing with good results. Now, in terms of vaccination protocols, I mean, we know that there's many other strategies. Like, I mean, the timing is one, but also the monitoring or surveillance, it's very important. I mean, in order to evaluate those interventions. We always put in place a monitoring system along with the vaccination protocol to determine if the protocol is working properly. That's very important because even if you vaccinate at processing, but if you're vaccinated by endemic pigs, you won't get the full benefit of the vaccination. Or even if you're vaccinated at weaning, and if you have an early exposure, probably you are not having the enough time to generate that immune response. So the only way to know those is through monitoring. So we put in place diagnostic monitoring, but also production data and everything. And with this analysis that we presented at Lehman, also highlights the importance of the monitoring, because if you're monitoring your prevalence in growing pigs, you can predict that the risk of having an outbreak in sow farms is higher. So then you can plan for action on biosecurity, vaccination, management practices. So it's a way to use the surveillance in a proactive manner to make decisions or to take actions. This is just one study, but we're calling for action right now for generate more research on growing pigs to understand better, because in our, we feel that this is some of the missing pieces that we are facing on PRRS elimination and control program.
Well, surprising results, but certainly valuable. We've been talking to Dr. Jose Angulo. He's a technical services veterinarian and PRRS specialist at Zoetis. Thanks again, Jose.